We're gonna call the executive committee of the Mississippi State Board of Medical Licensure to order. And first item on the agenda is a personal appearance by Carol Richardson, MD. Petition to lift limitations of medical practice. But first, I'd like to mention that we have Dr. Rod Givens and Dr. Michelle Owens is attending by Zoom this morning, and we have Pamela Ratliff, the Attorney General's counsel, and let's see, of course, Dr. Cleveland, our board president, and Paul Barnes, our board counsel.
I'm executive director, not president, but thank you for the promotion.
I'm the president, and Dr. Cleveland's the executive director. I misspoke, but anyway, good morning, Dr. Richardson. And who have you got with you there?
Good morning. My name is Lauren Stimmick. I'm from the Memphis-based law firm of Evans Petrie, member of the Tennessee and Mississippi bars, here representing Dr. Richardson.
Okay. Well, first, we'd like to hear from you, Dr. Richardson. Would you mind coming up to the podium and telling us how you were hoping that we might be able to help you?
Well, I'm before the board today. Something may be wrong with my mind because I want to, at my age, increase the scope or elevate the scope of my medical practice. For 6 years, when I arrived here in Mississippi, I had been a resident of Oregon, and I was an at-home mom at that time for about 12 years. My husband was an anesthesiologist, and he was practicing in Oregon. My last practice was in Michigan. And at that point, I decided that since I had a little one, that I was going to forego practice for family reasons. My mother could no longer help me. She had cancer. So I decided to be an at-home mom. So I did that for about 12 years. But then I decided I want to now go back to work. And it was when my daughter was about 14. So with family issues, I found myself here in Mississippi after a divorce. And I was invited here by not a colleague, but a friend who was a physician, emergency physician here in Mississippi. I didn't know where to go. I did have a license, but it was in my last practice in Michigan. And so I could not get a license in Ohio and Oregon, obviously, because I hadn't practiced for so long. But I did keep up my CMEs, and I did have a valid license. And so I came to Mississippi to see what would happen. When I came here, it was a little bit rough, but after 2 years, I was able to get my license. And in 2017, appeared before the board, and I started my practice. Now, of course, I was not able to practice OBGYN with the surgery part because I hadn't delivered babies for quite a while. But I was able to do office-based practice, and I did wonderfully well, and I enjoyed it immensely. And now at this stage of my life, I would like to venture out and to do some hospitalist work, in the sense that I would like to be able to, I believe, benefit the community, especially in this area where there is great need of OBGYNs, to get back into surgery and delivery.
Where are you located, Dr. Richardson?
Well, at this point, I just left my job at Family Healthcare Clinic in Flowood. That's where I had been for 6 years, since 2019 when I started practice. But I had wanted to, how should I say, increase the scope of my practice back in December 2024. But because I was only physician there working at the time, I did have a nurse practitioner for about a year and a half. I was so busy that I couldn't venture out and continue to try to see if I could increase the scope of my practice. So at this point, that's where I'm right now.
Okay.
Mhm.
Yeah, we reviewed the documents, and, uh, have you met with Dr. Cleveland, the executive director?
Yes, I did. Actually, I came in June. I think the date was June 12th. And I was having some problems um, renewing my license, because usually you can do it easily over the phone, over the internet, especially if you got your CMEs and everything, you could do that. But I couldn't do that for some reason. And so it was getting close to the deadline, and I just came up to the board to find out what was going on. And I met Dr. Cleveland. I had come like twice, 2 days in a row. And then I came that second time, and then Dr. Cleveland came in the lobby and asked me if was I here because of the change in the scope of my practice, which I had submitted a request back in December 2024. And I said, well, Dr. Cleveland, I'm not here for that. I'm really here for my license renewal, but if we can add that on, I would like to do that. And so that's what got the ball rolling again. So that's why I'm here now. Yeah, so I did meet. I don't know what kind of meeting that was, Dr. Cleveland. Was it just an informal chat?
It definitely wasn't scheduled.
Yes. Right.
But yeah, I had some time that morning, and so Dr. Richardson had some issues with renewals, and I was just interested in helping her resolve whatever issues there were. And so we met for 30, 45 minutes, I guess, and that's how we developed a plan for you to be here today.
Absolutely.
So y'all went over the proposed uh, re the return to practice plan.
Well, actually, what we did, since it wasn't a planned meeting, we did talk about it, because I didn't even know that there was a plan that was available. All I knew is I wanted to do this, and I submitted a letter. I brought it to the board, actually, and Dr. Cleveland didn't even receive that. So it was like everything was new for him. And so then he told me that there was a plan that you've already had outlined. I said, wonderful. So then he said he would email to me. He did. The office emailed it to me, and then I saw it. I said, this is doable. And then we made I had to make a formal request, like I'm doing now, to appear before the board with an attorney representing me. I thought I could represent myself like I did last time and not having to pay money, but that's okay. And I came. So that's how the meeting is scheduled for today.
Okay. Yeah, I think I was here when you re-entered practice back in 2017, but
Oh, you were here.
I don't remember that far back.
Okay.
But that was that was you did well from what I can tell. And by the way, I'd like to mention that Dr. Cleveland's been kind of a pioneer at the national level on this reentry to practice.
Oh, really?
Yeah, yeah, this is kind of a innovative
Well, he
approach.
didn't tell me that. I would have felt
Well,
less pressure.
he's very modest, but
Okay.
but anyway, tell me about your understanding of the return to the practice of obstetrical surgery and labor, because when's the last time you wielded a scalpel?
Do
Dr.
you
Rich?
really want to know? Do I have to say that?
Yes.
Okay. 2000. And I was doing a locums assignment at that time. And I like to do locums because I go to different places, I meet different people, and they give you everything. So I was doing locums at that point. That was my last locums assignment in where was that? New Hampshire, Woolboro, New Hampshire. And I had the distinction, I wouldn't say dubious, of delivering the first baby of the new year in 2000 in Woolboro, New Hampshire, as a locums. That was my last. I didn't have to wield the scalpel. It was a vaginal delivery, but that was my last delivery.
So you did not have to wield a scalpel.
I did not, but I could have.
So have like I'm a psychiatrist, okay?
Oh,
I
do you know that was my first practice in residency?
I did not. No.
Yeah, I did better in psychiatry than I did in OB.
Well, I did better in OB than I did in psychiatry.
Okay.
But anyway, uh, how many C-sections have you done?
Oh, my program, I delivered babies, did my residency at Howard University Hospital in DC. I can't tell you how many, but I will tell you this. I believe, and I'm not being boastful, I believe that I could probably still do a C-section in my sleep. We did so many. But I'm not going to say that because I don't want to appear too boastful.
But you're proposing, I mean, you're proposing through this return to practice plan to do all kinds of obstetrical and gynecological surgeries. Is that correct? I
Not
mean,
really.
what
What I would really want to do is, this is what my intention is, because I want to be a hospitalist and I'm getting calls every day. And I would say every day, maybe 3 times a week for work. Even in Mississippi, they need hospitalists.
what do
I w-
what the OBGYN hospitalists do?
Oh, what they do is, and it wasn't really in vogue when I left practice, but they will do, you have your doctor, the private practitioner in the office, and you have the hospitalist doctor in the hospital. So you get a patient and they call you, they say, Dr. Richardson, your patient is here. She is complete and she's pushing. The doctor's not going to be able to get from the office to deliver that baby, okay? Because he's just busy, or she. So the hospitalist will take care, deliver, do whatever, write the orders. And I don't know what happens with compensation, but the hospitalist is there, takes care, and the
If there
doctor,
were complications, you would have to deal with that also, correct?
no, the hospitalist will deal with the complication.
That's what I mean.
Yeah.
You would be the hospitalist. You want to be the hospital, and that would include any complications like bleeding, if a breach, delivery or
Absolutely,
murder.
absolutely. But this is the thing, doctor. Um, I don't want to primarily just be, how should I say, employed as a hospitalist. What I would like to do is continue with my office-based practice and be able to deliver if I need to. Mhm.
Dr. Givens,
Yeah, I'm Dr. Gibbons, I'm a radiation oncologist. So
Okay.
let me get a little understanding.
Mhm.
Your current practice office space,
Mhm.
what does that entail? Does it entail any procedures?
Or only office-based procedures. So with
such
that,
as-
okay, so okay. So anybody comes in, I diagnose cancer. So I do endometrial biopsy, I do vulvar biopsies, I do colposcopies. I was head of family planning for Mississippi, Louisiana, and Alabama. So I insert LARCs, LARC, which are long-acting reversible contraceptives, which is an office procedure, surgical procedure. And I would train nurse midwives in outlying rural clinics to do that as well. So that was the extent of my surgery. So when you asked Dr. Lippincott, what would I like to do? I would like to continue office-based, but when it's time for my patients to deliver, I would like to be able to deliver them. If I could not deliver because I'm in the office, the hospitalist would do that.
okay, thank you, Dr. Richardson.
Mhm.
And so could you just tell me your understanding of how you plan to implement this return to practice plan?
Okay, I've just put my feelers out there because I don't want to overstep my bounds because I had to, of course, appear before the board and see what do I need to do. So I need a preceptor and
Do you have any prospects for a?
yes, I have some prospects who I have not contacted yet. That's why I'm the board said I did not have to have who I wanted yet. And I'm saying, that's good, because I'm still looking and deciding, because it's going to be where I'm going to go, who I'm going to preceptor with. I live in Byram, Terry, Mississippi. Am I going to have to go to Meridian? Am I going to go? I don't know. So I haven't made that plan concrete yet, but I know I will have to have a preceptor, and I have some ideas of some doctors who may be interested in doing that.
Thank you. I'd like to recognize Dr. Michelle Owens, who just joined us in person. Dr. Owens, do you have any questions for Dr. Richardson?
Yeah, sure. Hi, Dr. Richardson. I'm Michelle Owens.
I know, not Miss Dr. Owens. I think you were just getting on the board when I came in 2017.
Yeah, that's
Yeah.
true. So I'm a OBGYN and maternal fetal
Yes.
medicine subspecialist.
Yes.
So just a couple of questions, because you
Mhm.
mentioned, you can't mention the Bisons and not get some follow-up questions. So you did your residency. I think one of the things that's often helpful for, the members of the executive committee is to kind of hear in your own words about your training. I know that historically Howard's training numbers have been relatively small program for a large population, a large group of
Yes.
people.
Yeah.
And so when you said that you guys were busy, I laughed because I remember what those numbers look like. But so if you'll just let me just educate us,
Yeah.
when did you complete your training?
I wouldn't want to answer that, but I know you guys know anyway. So I completed my training in let me see. Okay, medical school 87 to 91, residency 91 to 95.
So residency completion in 95. And if
Mhm.
you could just give us an overview of what your work history was like upon completion of your residency, because you mentioned that the last time that you were surgically active
Mhm.
with hospital procedures and those kinds of things was in 2000. So if we're talking about from completion of your residency up until that time, like what was your practice setting? Because I mean, locums in OB was relatively novel at that time.
Absolutely, you're
So
right.
what were you doing in between from the completion of your residency program through?
Well, Dr. Owens,
Yeah.
if you wouldn't mind, could I defer to my attorney? She has it all laid out. If that's okay with you?
Yeah, it's just, I was just asking where you worked at.
Oh,
And I think she's happy to answer that. I think
Yeah.
what she's referring to is we submitted a detailed CV.
Yeah, I
to
got that
Mr.
part.
Barnes. Okay, I
Okay.
think she just wanted to make sure you had that.
Yeah, no, not, I just giving you, so the CVs are great, but
mhm.
I like to hear it in your own words as opposed to
Absolutely.
like the actual, it's this is your opportunity.
Oh, yeah, absolutely,
so-
Dr. Owens.
That was the purpose of.
Oh, no problem, no problem. And by the way, Dr. Owens, let me just say this. I have a lot of high-risk patients at Family Healthcare Clinic and a lot of Hispanic patients, and I'm trying to learn Spanish right now. And UMMC, I just tell my patients, say, oh, UMMC, I kiss the ground. I'm telling you, because you guys are just absolutely phenomenal over there. But anyway, when I left Howard in 95, I started practice in Chattanooga, Tennessee, full-time practice, and I like federally qualified clinic settings. So that's what I did for 2 years. After I did that, I left that practice, and there was some complications with my, well, anyway, there was some discrepancies, and so I left there. And then I did some locums. I went to Alaska. I went some different places, and I really enjoyed that, but it was time to get back into full-time practice. At that point, I went to a full-time practice in Michigan. That's where I stayed before when I went as a mom. And in Michigan, I did everything. I was there for 6 years, and I delivered my baby, and then I moved to West Virginia with my husband, who's anesthesia. I didn't work then. And then from West Virginia, we moved to Oregon. And so that's where I was for the most part. But I did locums in between
Okay.
that.
And so any issues with any lapses in your, so are you boarded? Just refresh my memory.
Oh, yes, I was board certified in 2001.
Okay, and no lapses in, so you've done the maintenance certification and all that?
Absolutely, absolutely, every year. No lapses.
And so I think that these questions, and I was listening in before when you first came on and started your introduction.
Mhm.
Do you have at this point like a job? I know that there are lots of opportunities,
Mhm.
but is there something in particular that you have your eyes set on that you're interested in doing? And if it's something that you'd rather not say out loud, I guess that's fine. But do you have a particular practice or a particular position that you're eyeing at this point that has brought you here? Or is this just kind of in preparation for that moment that
what?
you see is coming later?
Well, actually, Dr. Owens, I was ready to make a transition in December 2024. But like you probably heard, I did not have a nurse practitioner with me. For the 6 years, I've been by myself until a year. I had a nurse practitioner, family practice nurse practitioner that I trained myself. And we worked together well for a year and a few months. When she gave birth to her fifth baby, and I told her, you need to go home. So she went home. She didn't want to stay. She wanted to stay with me. And so at that time, I I was so swamped. I was by myself. And then at that point, I had a buildup of our practice from me and then from her as well. So I just said, forget it, put this on the back burner. Let me see if I can, do what I need to do here. But I was just getting busier and busier with no help.
Gotcha.
No help. So then I decided when I went on vacation in April and did the Eugene Marathon in April, then went to St. Martin in late April, it's time for me to just kind of, so that's what happened.
So so if you could step into practice right now, how would you see yourself? I mean, because usually the the course of an obstetrical practice kind of changes as we gain more life experience.
Yes.
So how exactly, like, what do you see yourself doing now? Do you see yourself kind of doing the same thing you did when you went into general practice right out of residency and just kind of hit the ground running and doing full scope? Or you primarily want to practice on, focus on GYN? Are you still wanting to do obstetrics? Or are you interested in a hospitalist position, which is really heavily labor intensive? You could possibly still do, emergency GYN surgeries. But I think back like from 2000, which interestingly was the time when I finished my training, or, stepped into residency. Surgery has changed a lot. Especially with the minimally invasive component in GYN surgeries that you would typically see in a hospitalist role, which is going to be ectopics in the middle of the night and those kinds of things. That stuff is a lot different. They don't do laparoscopies the way we started out doing laparoscopies. So there is going to be, a pretty significant learning curve if that's the kind of stuff that you wanted to incorporate into your practice. So have you thought about that?
Absolutely. Absolutely. What I have thought about being in practice, what I'm doing like for 6 years, this is what I really want to do. I want to continue to do office-based. And when my patients ask me, Dr. Richardson, are you going to deliver my baby? I can tell them now, which I'm thinking if I'm not wrong, yes, because I don't plan to be in the office every day, 9 to whenever I got out. Okay. And I don't want to do robotics. I don't want to do all that complicated stuff. I don't feel I'm too old to do it. I just don't want to do it. I just want to be able to be available. If I need to take call, like a lot of these agencies call me, Dr. Richardson, can you do call 3 nights a week in Meridian? I can say, yeah, I could do that. That's what I would like to be able to do. Can from the the recruiters looking for people, doctors, OB doctors to do call. They can't find them. They don't even want to come to Mississippi. They really don't. So if I can fulfill that need, I would love to do that. I don't want to be in that, that practice that you hit the ground running, you seem, I don't want that.
Okay.
Mhm.
Thank you for that.
You're welcome.
Those are all the questions I have.
And one more thing, Dr. Owens, I'd like to say, at the time when minimally invasive surgery was becoming the vogue, I'll just say this, Howard University is HBCU. They're kind of old school. We lost our accreditation the year I graduated because we were not willing to go with everybody else. We were slower. So even then, when I graduated from the program, I had to have refresher courses to get into minimally invasive surgery. And I found it a bit difficult for me. So that's not really what I wanted anyway, so.
Well, you'll be happy to know, I actually currently wear another hat where I sit on the review committee for ACGME, and you'll be happy to know that Howard is fully accredited. Their program is thriving. They're doing really well.
Oh, yeah, no, I keep abreast of that. I knew afterwards, but I was the residents who graduated after me, they had to all find places for those residents. It was really sad. But then I know I visited last year, so, yeah, thank you.
Good things now, and their department there is one of my former co-residents.
Oh, really? Oh, okay, thank you for that.
Thank you, Dr. Owens, and thank you, Dr. Richardson. Are there any further questions from the board? Dr. Richardson,
Yes, sir.
let's see, Ms. Stenick, do you have anything you'd like to say to us?
I don't, Your Honor. I'm sorry. I'm so used to being in a courtroom. Sorry to say, Your Honor, giving you more education and degrees than you may have. No, I would just assure the committee and the board that Dr. Richardson has signed the agreement regarding her preceptor requirements in the event she is permitted to pursue this additional practice area. And so she is fully committed to adhering to that agreement and eager to get started on the work. And if anyone has additional questions for her, I'm sure she'd be happy to answer them. We're very appreciative of the time that you all have given us this morning and the opportunity for her to present this and be considered.
Okay, thank you. If there's no further discussion, do we have a motion in this matter of a petition to lift limitations of medical practice and a reentry to return to unrestricted practice protocol? Do we have a motion?
So I would move to approve the request to lift the restrictions based on compliance with the agreement, the signed agreement that we have in front of us. And this is to facilitate the licensee's process, the reentry process.
Okay, we have a motion. Do we have a second?
I'll second.
We have a motion and a second. All in favor of the motion, say aye. Aye. Any nays? Any abstentions? Nope. In that case, we approve your petition, Dr. Richardson.
Thank you very much.
And
thank you, Dr. Owens, for making the first move. That was.
and just follow up with the executive director, Dr. Cleveland. Once you have more details on the
Preceptor.
on the return to unrestricted practice agreement. Yeah.
Sure. Thank you.
Oh, also, Dr. Richardson,
Yes.
I kept quiet about Howard, but actually graduated from there undergrad, so,
From undergrad, from Oakwood?
no, Howard.
Oh, you did? Oh, okay, all right. Thank
I
you
was
for
there.
letting me know
I was-
that.
Trying to get into med school at that time. I got in there, but.
Oh, you got into
My hair.
Oh, you know, check this out. I applied to Meharry. They didn't get me in. They didn't. So I'm glad I'm a Howard grad.
Both turned out.
Well, I'm glad to hear that. Thank you. Thank you. Am I done?
You're done.
Yes,
Okay, thank you.
oh, okay. Yeah, Francis.
Harry is actually, do you know Oakwood University? I'm an Oakwood grad.
Yes.
So many, oh, right. And I was very disappointed when they didn't admit me.
Too many people hanging out around Normal and Huntsville for my
Yeah.
taste. I'm just.
Would you like me to tell you what I've been up to?
Uh, uh, yes, Dr. Cleveland, please give us a report.
So this is going to be pretty brief today. And just as a reminder, I meet with the other executive directors and deputy directors of all the other health boards. When I say all the other health boards, that's a little inclusive, but it's with pharmacy, nursing, the health department, and dental. And then, of course, we continue to meet monthly with the PHP to review everything, all things PHP, including the financials and things like that. I was invited by the family practice residency program to speak to the residents, including the brand new residents, which was kind of fun. They wanted me to speak to them about Part 2640, which is our prescribing regulations, especially for controlled substances. And so we had a very nice 1 hour little back and forth with the family practice residents. And I met with several licensees concerning potential violations of the Medical Practice Act and our regulations. And just last week, I was in Cape Cod as a board of director for FSMB. And it was, every year they do an annual new chair retreat, and that's where it was this year. And it was awesome. So anyway, had some really good lobster. So that's it.
Thanks. By the way, thanks for that report, Dr. Cleveland. I might, mention I'm not gonna be able to make the board retreat in August because I'm gonna be up, visiting my son's family in, Portland, Maine. So we'll probably get some lobster too.
We'll note it in your file.
Thank you. Thank you. If there's no further business for the executive committee is adjourned.
All right.
Thank you.